Welcome back to the City Current Radio Show. I'm your host, Jeremy Park. We're coming to you from our home studios because we want to make sure that you are safe and healthy. We're joined by someone who is a specialist in the medical arena, shoulders and elbows. We have a shoulder and elbow surgeon with Campbell Clinic with us, Dr. Tyler Brolin. How are you doing, sir?
Thanks, Jeremy. Thanks for having me.
So Campbell Clinic, very well-known institution, obviously here in the Mid-South. What people may not know is when you look at kind of the international recognition, Campbell Clinic is very well known within the orthopedic industry. And so you've got a new facility, you've got a lot of growth, you've got a lot of cool things to talk about. Give us, though, a little bit of, when you talk about Campbell Clinic on your end, a little bit of a snapshot of just how you describe the efforts overall and just kind of give us a starting point of just the basics for Campbell Clinic.
Yeah, Campbell Clinic has been around for a while, and our emphasis is really on taking care of the greater Memphis area and providing the highest quality orthopedic care. We've fortunately had a number of past presidents in the Orthopedic Association, as well as a well-known operative textbook, which makes us well-known internationally.
Yep.
But really, our emphasis is on providing the highest quality orthopedic care that we can, and we're excited that we just opened up a brand new building, a brand new state-of-the-art building at the corner of Wolf River Parkway as well as Germantown. And like I said before, we wanted to give the patients around in this area the best experience, the best orthopedic care experience that we can, and we think we've delivered on that.
When you look at the new facility, talk about what that means in terms of being able to do more. And obviously you mentioned state of the art. So give us a little bit of a teaser of just the new facility.
Yeah, the facility itself is 4 stories, and we put in 8 state-of-the-art operating room suites. And I had the opportunity to recently operate in one, and they truly are exceptional. And also a part of this is we've had this Excel Performance and Wellness Center, which is our sports performance facility. This is led by Drew Graham, who's a former NBA Trainer of the Year. And here, members can really enjoy personal training as well as movement assessment. They get all the bells and whistles. They can train on the turf. They can use water treadmills as well as anti-gravity treadmills and have the most recent techniques in recovery. We tailor all programs not only to the athlete, but also the person who just wants to get back in shape. So we're trying to establish not only the acute orthopedic care, but also health and wellness.
Yeah. We'll talk about obviously your specialization here in a second and dive into some tips and expertise. Talk a little bit about, though, just the kind of the give back side. I think there's a really cool angle on you and your team, very philanthropic, out in the community always. You have a number of kind of give back opportunities throughout the Mid-South. You have a foundation as well. So give us a little bit of just the philanthropic side of everything that you do.
Yeah, so the Campbell Foundation, which is our foundation affiliated with Campbell Clinic, is very active with the community. We've done Souls for Souls. That means provide foot and ankle care for homeless people in the region, as well as we send one of our residents overseas to provide orthopedic care to developing nations, as well as other different fundraisers around the community, and that is part of our mission. It's not only just provide the orthopedic care, but also be part of the community of the greater Memphis area.
Yeah, it's been awesome. In the past, we've had different different team members come on who have gone on some of the medical mission trips, and to be able to hear their perspective of just taking not only equipment, but their expertise and being able to teach and train. And then obviously it really does kind of come back because in many places they don't have the state-of-the-art equipment. And so trying to figure out how do you make the most with what's available so that you can deliver the world-class care, but also to train them so that ultimately this continues this pipeline of just talent development.
Yeah, that's exactly right. Is we could go over there and help them, but it's really the educational standpoint. Because if you teach them how to provide this care for their patients, then they can teach others, and it just builds on itself. So we've just had a strong foundation on education. That's with resident and fellow education, as well as bringing in other surgeons to learn the most recent techniques. And so we like to do that abroad as well.
So let's dive into your world specifically. And I'm a tennis player, so when you talk about elbow and shoulders and things along those lines, man, I know this all firsthand. But when you talk about pain and someone saying, my shoulder's starting to hurt, elbow pain, how do you decide when is the time to come in and see you? When is it not? What's your advice on just, you know, pain management and starting to actually go see an expert?
Yeah, that's a good question. And so, unfortunately, soreness is a part of life, especially as we age. So it's when it starts to affect your sleep, and when it starts to affect your activities of daily living, your hobbies as well as your job, and it lasts for more than a few days. That's something that you may want to get checked out. And so I tell everyone that if it doesn't go away after a few days with some rest, ice, as well as some anti-inflammatory medications, then it's probably worth getting checked out.
And I know when you talk about joint replacements and those sort of things, obviously, if there's an injury, that's an obvious opportunity. But at what point is it? Is it age? Is it like you said, just hey, I'm having this pain over and over and over again? Come in and see you, and then it's case by case. At what point do joint replacements start coming in? And obviously, the technology now is so much better. So I think that's an opportunity as well.
Yeah, and so first is arthritis is fairly common, and we've gotten good at treating arthritis. And the good news about arthritis is we have many different ways of treating it. Anti-inflammatory pills. We can add an injection if need be. Some physical therapy. But the bad news is it's usually progressive, and so there's plenty of people walking around with arthritis that don't need joint replacement. But when you get to the point where the simple things have failed, we always want to try the simple things first, right? The anti-inflammatory medication or Tylenol, the potential injections. But when those are not helping your pain or helping to increase your function, then we have to look elsewhere. And that's when joint replacement becomes a viable option. Now, I'll tell you, the vast majority of joint replacements are elective. So I rarely tell a patient that they need to have a joint replacement. It is a discussion with them, but it's ultimately their call. And so when I look at it, is there's three facets to life. There's hobbies, there's work, and there's sleep. And when your pain as well as your decreased function start to affect two out of those three facets, that's usually when it brings patients to my office as well as potential surgery.
Yeah. Talk about the difference between total, partial, reverse shoulder replacement.
Yeah, the partial replacement. If you think of the shoulder, it's like a ball and socket joint, and a partial replacement. What that means is removing the ball and just replacing the ball with a metal part. And so now you have a metal ball on the cartilage of the socket. We rarely do this nowadays anymore. And so this was used in the past, but with the advances of the total shoulder replacement as well as the reverse shoulder replacement, this is rarely done. The total shoulder replacement just means doing exactly that, doing the partial shoulder replacement, but also adding a piece of plastic to the socket. So with people with arthritis, they have bone on bone uh, grinding on each other. And so that's what causes the pain. So now we take that away and we give them metal on plastic, which gives them a smooth surface and a smooth articulation, which decreases the pain. A reverse shoulder replacement is just that, is where the socket is, we put a ball and we screw a metal ball onto the socket. And where the ball was, we take the ball off and we put a socket. We reverse the order. And this is used for patients that do not have a functional rotator cuff. And in the past, we had very little options for these patients. But in 2004, the FDA approved this shoulder replacement, which has really revolutionized shoulder surgery.
Share, you mentioned kind of anti-inflammatories and going down that path. Talk about how all of this ties in with the opioid epidemic and pain management. I know that there's a lot of progress on both sides in terms of making sure that you're taking care of the patients, but at the same time, now there's more of an acute focus versus just a broad application. which is helping to minimize some of those issues. Share, from your perspective, how all this is playing out.
Yeah, the biggest thing is it's nice when these anti-inflammatory medications can work. You always want to use it in moderation because they have side effects as well. But the things that we use are the non-opioid options that we have for addressing pain preoperatively is just that: Tylenol, anti-inflammatory, the occasional cortisone or steroid injection. Physical therapy has been shown to be beneficial to treat multiple musculoskeletal um, um, issues and conditions. Sometimes we can do nerve ablation, which temporarily disrupts the nerve signal, which to painful joints, which decreases the pain. And also, there's been more and more studies with orthobiologics, or that stem cell or plasma-rich protein injections. And all of the goal is to minimize the opioid medications that we take. And we know from the opioid crisis that there's not only side effects of it, but dependency and abuse issues.
Putting on, so, on our end, obviously sports, health, physical fitness, so important, obviously, and especially for kids. What are some things that we can do? I'm thinking like stretches and just in general, what are some things that we can do to protect our bodies and protect ourselves and make sure that as we are going out and being active, that we're taking care of our shoulders and elbows?
Yeah, that's exactly right. Is so maintaining a certain level of fitness, and where I think people get into some issues is all of a sudden they haven't been active for quite some time, and then they want to jump right back into it, and so they have to know that it's a gradual process. And of course, stretching, but the biggest thing is just maintaining a certain level of activity, and knowing that it takes time. And so, sometimes we have certain athletic classes that patients want to jump into, whether it's the New Year's resolution or what have you, and that's where you can end up getting an injury. And always learn from a athletic coach, which can be beneficial and worth the time.
Yeah, absolutely. So you're getting uh, good advice and making sure that you're taking care of your
Yes.
body and yourself. Talk about obviously coronavirus, COVID-19, the pandemic, and obviously it's affecting everyone. How is it affecting Campbell Clinic and you and your operations?
Well, medical care is essential, and we continue to see and evaluate patients that need to be seen for their orthopedic needs. And we recently implemented patient care via telemedicine, so patients now over the internet can be assessed. And these are new patients or established patients within our clinic. But really now, more than ever, patients can benefit from being evaluated by one of our orthopedic specialists rather than going to the emergency department. And we need to limit these unnecessary visits to the hospital and the emergency department in order to decrease our exposure to the COVID-19, as well as to preserve the hospital resources. So patients can simply walk in to our clinic and be seen by a specialist the same day. We have walk-in clinic as well as after hours that are open from 8 a.m. to 8 p.m. Monday through Thursday, and 8 a.m. to 5 p.m. on Friday. And we're more than happy. And really, we think that we fill this need and this niche where orthopedic patients are not necessarily sick. They're injured, and they can come directly to the specialist and get their orthopedic needs taken care of without being exposed to potentially the sick patients in the hospital.
Yeah, I think that's an important note is that you are still open and you are still helping people, and you do have flexibility both in terms of the scheduling, but also to multiple locations. So the fact that you guys can really be a huge asset. And to your point, people are still trying to maintain their healthy, their activity, and with that, there comes a need, obviously, for everything that you do.
Yeah, and there's a certain level of fear with the coronavirus pandemic, and so um, and rightfully so. Is there's fear over the protective equipment? There's fear over the ICU beds in the hospital, and so we really have to be careful with our resource allocation. And we just think that we can serve our community by helping detour patients from the emergency department into our clinic.
Yeah. Last question is the easy one is where do we go to learn more? So website, phone numbers, any of those sort of contact information, where would you send everyone?
Yeah, so they can always go to campbellclinic.com to learn more, and they can call our phone number, which is 901-759-3100. The appointments is 901-759 and 3111 and to schedule an appointment. And they can always look at our website. There's good educational websites from the American Academy of Orthopedic Surgery that they can look at different shoulder and elbow complaints. But we're more than willing to evaluate any patient with musculoskeletal needs.
Well, Dr. Tyler Brolin, thank you for all you and your Campbell Clinic team do. Greatly appreciate it. Thank you for being on the show.
Thanks, Jeremy. Thanks for having me.